Coronavirus. COVID-19. Silent expansion, you can feel completely healthy and be a carrier of the virus. This is a virus that tests altruism and solidarity, true commitment to the common good. It is about thinking about the most vulnerable and not about yourself. As the COVID-19 was expanding even slowly in Spain, I witnessed a particular phenomenon. Even though our channel does not refer to health, we want to mention this little reflection on this pandemic that is affecting everyone, coronavirus COVID-19. We ask you to support our channel, your valuable subscription, and that you can activate the doorbell so that you continue to receive videos like this. On the one hand, the press began to warn of the risks that could develop if the virus spread in Spanish territory, and, on the other hand, people flooded social networks with messages that minimized the effects that this health problem could generate. The phenomenon found an equilibrium point as the cases increased. The media increasingly presented better content, more focused on serious problems than on the exact count of the number of infections and deaths. And citizens began to share messages that called for conscience to abide by the recommendations. Although China and Italy had already shown that when the community contagion was confirmed it was time to apply a mandatory quarantine, the measures in Spain were gradually applied, while the virus continued to demonstrate that it could spread exponentially in a matter of days. Despite the fact that in the Spanish territory the 1,000 contagions had been exceeded on March 9, they waited 5 more days to declare the state of alarm and quarantine the country. It seems that living in a globalized society, with information about what is happening around the world, has not cured people of ignoring problems when they consider themselves far away and paying attention only when they explode in the face. Before applying this radical measure, it was tested with partial measures, typical of the proportionality criterion that is applied to controlled situations. Among these were the limitation of flights from high-risk areas and the cancellation of classes. Time showed that these partial measures did not stop the increase in the number of infected or deaths. The late application of compulsory quarantine resulted in cases continuing to increase. Spain left a new lesson: the proportionality criterion only applies in known and predictable situations. With the COVID-19 only the silent spread of the virus is favored. The situation confirmed, once again, that the most effective measure was quarantine with mandatory isolation. Caring for the most vulnerable. The coronavirus came to remind us that we are an individualistic society and that what we must heal is the hearts of the people. This virus does not have a vaccine, nor a treatment that allows controlling it. There is only one true fact: to stop its spread, you must avoid contact with infected people or places where there have been infected people. Simple and easy. The virus brings 2 traps. The first is that it has a long incubation period, therefore, one can feel completely healthy and be a carrier of the virus. During the period that a person still feels healthy, he can spread the virus without showing any signs. And the second trap is even more dramatic. In the first statistical analyses of the treated patients, it was found that the vulnerable population was the elderly and those who had previous respiratory pathologies. With these 2 traps, the virus has been circumventing all the containment attempts it has faced. The solution mechanism is very simple and everyone knows it. As soon as the virus is detected in a locality, everyone should stay at home for a minimum of 2 weeks. The problem is that for people who feel healthy and who are not part of the vulnerable population, this seems to be a sacrifice that is not worth taking. And this is what the virus has shown so far: the non-vulnerable population prefers to continue living their lives without any restrictions. This is a virus that tests altruism and solidarity, true commitment to the common good. It is about thinking about the most vulnerable and not about yourself. In short, it is about overcoming individualism and orienting yourself towards the community. I like to think that after the evident call of attention that we have received as a society, these times of crisis tend to bring out the best in people. Italy and Spain, countries that already had the experience of China, but where the virus was not controlled in advance. The weekend before, when the quarantine was announced, you could see bars and clubs full of young people who were totally unconcerned with the situation, compulsive shopping in markets and supermarkets that aggravated the feeling of insecurity, and social gatherings with different purposes that could have been avoided. I believe that experience teaches and it is time to learn. There is no special science in this context. It is up to all of us to take charge of the matter and demonstrate that as a society we can face a virus, that all that is required of us is to think of the other. This is the revolution that we are invited to start. Finally, I would like to highlight the work of the anonymous heroes who day by day in the different health posts face this disease. In Italy and Spain, citizens have already paid tribute to them in various ways. It is important to recognize the work they have been doing in this initial stage. We cannot run the risk of saturating our health system because the consequences would be very severe. It is up to us to take each of the quarantine measures seriously. It is simple, it is up to us to stay home. We are at the moment of facing this crisis from a sense of solidarity and with a constructive attitude, where the orientation to the neighbor is the key to get ahead. We ask for your valuable subscription to our channel, share the information and help us, like, share and comment. We must create awareness that it is a fight that we must all wage against the coronavirus.